Our next speaker is Ms. Kathryn Campos, who is a student researcher at the University of Washington School of Medicine and Department of Surgery, and in the Harborview Injury Prevention Program, who will also be talking about pediatric injuries during wartime. And I'm excited to hear this presentation. Thank you very much.
Good afternoon. It is an honor to share time with all of you again this year. As mentioned, over the past few years, I've had the pleasure of performing undergraduate academic research in the University of Washington Department of Surgery and Harborview Injury Prevention Program. I am currently a King's College London Masters in Global Surgery candidate performing dissertation research in the King's Conflict and Health Research Group. Today, I will be presenting Pediatric Injuries During Wartime Require Efforts to Support Pediatric Surgical Trainings. I have no disclosures. To start, I will provide some background on children in armed conflict. Then I will present an overview on the prevalence of pediatric injuries in armed conflict settings. And finally, I will discuss capacity building tools, surgical training efforts, and some key considerations to support local healthcare and humanitarian actors towards providing dynamic pediatric surgical care in war zones. War heavily affects our world. Currently, we are experiencing 56 state-based, 72 non-state-based, and 40 one-sided violence-based conflicts. Unfortunately, civilian populations are disproportionately affected by armed conflict, accounting for up to 90% of total casualties in certain settings. Children represent a significant percentage of casualties and injuries in these contexts today. 1 in every 6 children around the world is affected by armed conflict. 160 million live in high-intensity zones. 420 million are residing in war-torn settings. And in total, an estimated 25 children have been killed or injured in conflict settings every day for the past decade. Mechanisms of injury vary based on context. For example, in Syria, 83% of total pediatric injuries have been due to explosive weapons. In 2019, suicide bombs, landmines, unexploded ordnance, airstrikes, and other forms of explosives accounted for 72% of all child fatalities and injuries across the world's deadliest war zones. Most notably, state actors were the perpetrators of at least 53% of all child casualties from explosive violence between 2011 and 2019. According to the World Health Organization, pediatric injuries in armed conflict settings and the delivery of health services are significantly impacted by barriers to care as indicated by JANIN researchers in the table to the right. In addition to violations in international humanitarian law, denial of humanitarian access, fragility of local health systems and workforce losses, the urbanization of warfare, and advances in explosive weapons. Now, while advocacy efforts such as the Geneva Conventions, Cluster Munition Coalition, Branch Consortium, and Resolution 1612 and 2268 have been integral at calling attention to the protection of children and vital health services in conflict settings, millions of children remain under attack and continue to face the threat of being maimed and killed today. Seeking to gain a broader understanding of pediatric injuries and efforts to support pediatric surgical care strengthening in armed conflict settings, I performed a systemic review spanning over a 10-year period to first, look at the prevalence of pediatric injuries, and second, evaluate pediatric surgical training and capacity building activities among local and humanitarian actors. Reports selected for inclusion provided qualitative accounts and quantitative data aimed at addressing pediatric injuries, proposed surgical training, and capacity building solutions for local healthcare workforce and humanitarian clinicians operating in conflict. After initially reviewing 1,192 articles, a total of 7 reports were selected for inclusion. 4 target areas to support pediatric surgical training and capacity building activities were identified. First, let's look at the prevalence of pediatric injuries in armed conflict settings. In 2021, Wild and researchers indicated that children in conflict remain principal victims of blast injuries, gunshot wounds, burns, assault, blunt, and penetrating trauma, as highlighted in the table. Specifically, blast injury was the most frequent mechanism of injury among children, accounting for 57% of total injuries compared to 24.8% in adults. Considering these figures, it is also important to note that children are 7 times more likely to die from ballistic injuries than adults. They are also 50% more likely to be victims of blast injury during post-conflict due to the increased likelihood of partaking in outdoor activities. As many of us here may know, management of these injuries may include pre-hospital care stabilization, CABCD assessment and intervention, resuscitation, antibiotics, damage control, multi-specialized surgical care, debridement, hemodynamic management, operative or prosthetic revision, pain management, ward care, and rehabilitation. While many of the same principles apply to adult interventions of care also apply to injured pediatric patient populations, various studies have called attention to some distinct differences in the management of explosive weapon injuries in children. For instance, a 2019 mixed methods study by Hargrave and researchers determined that ballistically injured pediatric patients often present with distinct and frequently more diverse patterns of injury in comparison with adults. Similarly, a meta-analysis study by Haverkamp and researchers in 2019 found that among a cohort of 5,012 pediatric patients that were injured from explosive weapons, 73% needed 2 or more operative procedures. And at the end of study, these researchers advocated for specialized training for providers in conflict due to the higher rate of injury sustained and in-hospital mortality witnessed among pediatric patient populations. When looking at capacity building activities, 4 primary components to enhance pediatric surgical care were identified. These included the utilization of the Pediatric Injury Field Manual, implementation of pediatric injury prevention interventions, promotion for collaborative multi-stakeholder partnerships, and the adoption of clinical training activities among local and humanitarian actors. For example, the Pediatric Blast Injury Field Manual was established through a conjoint partnership between the Imperial College London Blast Injury Research Group and Save the Children. It has since been distributed to over 100 clinicians in 12 conflict-affected nations and has been heavily promoted as an impactful tool to aid clinicians in conflict with providing effective pre-hospital, surgical, and rehabilitative care. In evaluating surgical training programming, the need for increased local and humanitarian clinical workforce support was overwhelmingly apparent. Pediatric training for local non-peds surgical specialists and humanitarian clinical actors may be supported through humanitarian surgical training, such as the hostile environment surgical training and surgical training in austere environment programs, pediatric trauma and train the trainer courses, e-health services, and global partnership initiatives. For instance, a 2018 case study assessing tele-PQ consultation programming in Syria to support the care of injured pediatric patients found positive results when clinicians were able to gain real-time management recommendations from highly trained pediatric surgical personnel and advocated for further research to assess the impact of telehealth programming on clinical skill building and patient outcomes. The same year, MSF came out with a 7-year study assessing their telehealth service program, providing specialty consultation, including surgical care, with over 50% of total consults consisting of pediatric cases. Overall, researchers found that offering direct specialist expertise improved the management of patients and provided additional educational value to field physicians. Modern-day conflict has become increasingly protracted. Efforts to support sustainable and effective pediatric surgical care in armed conflict settings is vital. Numerous reports cited surgical training activities among local and humanitarian actors as essential towards increasing access, capacity building, research, knowledge exchange, and workforce accreditation. And it is also viable towards mobilizing key stakeholder engagement and improving injured pediatric patient outcomes. 90% of the reports in this review advocated for further research to investigate pediatric injuries, injured pediatric patient outcomes, and pediatric surgical care programming in armed conflict settings. Some of the key considerations pushed forward included the implementation of an updated pediatric injury severity scoring system that is applicable to conflict settings, and the adoption of a pediatric trauma registry. Specifically, due to a high prevalence of non-uniformed and underreporting, increasing epidemiological research in pediatric injuries within armed conflict settings was highly advised. In addition, we need improved monitoring and evaluation programming that may mobilize solution-building activities aimed at rapidly responding to frequently changing context, pediatric patient population, and clinical workforce needs. Moreover, as a collaborative community, we must actively work with local healthcare actors to establish locally informed pediatric surgical training and capacity building initiatives in order to strengthen humanitarian surgical response programming and surgical sustainability within these settings. Finally, future research to evaluate the impact of pediatric surgical training activities among local and humanitarian actors is critical to enhance clinical skill building, reduce mortality, and improve injured pediatric patient outcomes. In conclusion, based on these findings and recommendations, currently few reports describing pediatric surgical training activities in armed conflict settings are available, and efforts to support research strengthening and pediatric surgical training initiatives among local and humanitarian actors is imperative in order to improve outcomes for children injured in armed conflict settings. Pediatric injuries due to war not only affect the children who fall victim to them, they also affect the providers treating them. It is timely and critical that together we build the foundation for clinicians in conflict to have access to support, specialized training, and resources they need to enhance capacity, save lives, improve outcomes, and increase patient-provider security. As we all know, the problem is not in the presence of darkness, but the absence of light. So I ask myself, and I'm asking you, to consider what we can do to share our knowledge, our talents, and our action towards supporting those caring for these vulnerable patient populations. Together, we can all do our part to raise awareness and bring about positive change to address this important issue affecting our children and clinical community residing in conflict. Lastly, I would like to acknowledge and express my gratitude to all of the following faculty mentors and division programs for their support and willingness to share their knowledge with me. Here are my references. I will now open the floor for Q&A.
Okay, thank you very much, Ms. Campos. We do have time for one question. I'm compelled, however, to make a comment. You know, I had heard this news reportage that the Russians, as they pulled back, withdrew from their attacks on Kiev, were laying landmines. And I can only imagine from your presentation that the principal victims are going to be the children, because they go play in fields and so on, and there's these landmines. So it seems to me that, quite frankly, one of the best preventative measures would be to send both equipment and personnel to scour the landscape for mines and remove them. So perhaps you could comment on that.
Yes, that is a great topic. Absolutely, prevention is key, and one of the exciting things that I think is being really pushed to the table in the humanitarian medical community, the humanitarian surgical community, is injury prevention intervention programs that may include activities like disaster risk reduction, DDR programming, to reduce the likelihood of these occurrences from happening.
Well, thank you very much.